to 3,968 confirmed cases of COVID-19 and 80 deaths to date. As of today, we have 227 hospitalizations and 79 in ICU. We are very fortunate to have amazing healthcare workers and top-notch medical facilities to be treating this virus. Because of this, our numbers are continued to remain comparatively low relative to other regions. Additionally, countywide 1,510 tests were conducted today, bringing our total number of those tested to 61,619. Our healthcare agency as well as private labs are rapidly increasing the number of tests here in Orange County so that we can get a more accurate representation of the rate of spread for the virus. Which brings me to a recent letter we received from the members of the Orange County Congressional Delegation expressing concern over testing availability and the number of those tested. I appreciate the concern our congressional delegation has when it comes to these matters. I, too, share concerns about ensuring our community has everything it needs in fighting this virus. To be clear, Orange County does not have a testing shortage, but please allow me to explain Orange County's approach to testing since this pandemic began. In fact, we have the capacity to conduct 9,000 tests a day. Last week, the California Department of Public Health issued new guidelines to expand testing into new categories. Under the new guidelines, counties are permitted to test more. We have now started testing the asymptomatic people in the highest risk categories, which includes frontline health workers and first responders. We are working with the healthcare agency and medical providers across the county to continue expanding the availability of testing. While we have seen an increase in cases since testing has ramped up, the positive rate has actually declined. I'd love to address the fact that in comparison to our neighboring counties and the state as a whole, Orange County has some very promising numbers. I'd like to go over some of these numbers. As you can see on the slide behind me, per 100,000 confirmed cases, Orange County has the lowest rate of confirmed cases in comparison to our neighboring counties and the state as a whole. Orange County stands at 116.3 per 100,000, with LA County at 320.4, Riverside County at 215.1, San Diego County at 154, San Bernardino County at 143.8, and California as a whole at 178.2 per 100,000. Further, Orange County has the lowest rate of COVID-19 related deaths at 2.5 per 100,000. This is in comparison to LA County at 15.1, Riverside at 9.2, San Bernardino at 6.3, San Diego at 5.7, and California as a whole at 7.3 per 100,000. Orange County also has a daily COVID-19 related hospitalization rate of 7 per 100,000. This is in comparison with LA County at 17, San Diego at 10, Riverside at 8.4, San Bernardino at 6.8, and California as a whole at 8.3 per 100,000. Overall, COVID-19 positive test percentages are at 6.3% and slowly decreasing over time. Orange County is testing more. A decreasing positive test percentage is a good sign. Taking all of these statistics into account, Orange County is in good condition as we continue to increase our testing in the fight against this virus. On Tuesday, the Board of Supervisors voted to reopen parking lots at all county regional and wilderness parks. County staff are now in the process of reopening the parking lots at these Orange County Parks locations, and they will be open on Saturday, May 16th. All Orange County residents love our Orange County parks, and we want them to enjoy getting some fresh air and exercise while getting a much-needed mental health break. Next, I want to address the reopening of Orange County businesses because it is a critical element for our families. Yesterday, I sat together with the chairman of the Board of Supervisors from San Bernardino County, Riverside, and San Diego counties. We are population-wise number 2, 3, 4, 5, asking Governor Newsom to meet with us to discuss our regional differences and how we can create a reasonable set of guidelines to reopen quickly and safely so that we can explain our region, our differences with his directives, and chart a path forward together. I'm grateful my colleagues sent out the letter yesterday morning. Many Orange County residents are currently dealing with the economic and emotional issues related to the pandemic, and I want to assure you that your county is working hard to assist you. It's vital that we get all of Orange County back to work safely. We continue to receive correspondence and hear from constituents who are hurting. And lastly, right before the press conference, the governor outlined his May budget revision. The impacts to the county are drastic, and we are currently assessing just how they will impact us. Today's press conference will have Dr. Clayton Chow, Director of Healthcare Agency, as well as Dr. Nicole Quick, our County Health Officer, who will be joining us on the phone to answer the questions. And lastly, we will have our CEO, Frank Kim, available to answer any questions as well. And I want to invite Dr. Chow up here.
Thank you, Chairwoman Steele. Good afternoon, everyone. My name is Clayton Chow. I'm the new director for the Orange County Healthcare Agency. I wanted to outline the trend that we are seeing at HCA in regard to the number of COVID-19 cases. The new testing facility that will be coming online, as well as provide some background on our reopening guideline that I discussed with the Board of Supervisors on Tuesday. So we have seen a slight uptick in the number of COVID-19 cases in Orange County in the past 2 weeks. Today, we are reporting additional 229 positive cases. However, this increase is not attributable to more testing opportunities being available. Much of this increase is driven by the volume of cases identified in the nursing homes and jails in the past 2 to 3 weeks. HCA is now reporting 227 hospitalizations, with 79 of those cases currently in ICU. As I mentioned earlier, a large proportion of new cases identified in the last couple of weeks have been identified in nursing home and jails. Therefore, it is critical for HCA to continue to monitor and assist in congregate living situations, as many will result in severe illness given the medically fragile nature of those living in nursing home facilities in particular. The congregate care population also accounts for a fair proportion of the increase in hospitalized cases we have seen as well. So as we continue to address COVID-19 in Orange County, it is imperative that the residents, all of us, wash their hands, maintain physical distancing, and wear their masks in public settings. It is also important that Orange County residents have access to COVID-19 testing. This is why HCA has a list of all the sites across the county where residents can go to get their COVID-19 tests. In fact, we're happy to report that Orange County Healthcare Agency has partnered with the California Department of Public Health to launch 4 new testing sites in the city of Buena Park, Orange, Santa Ana, and San Juan Capistrano. The state sites are powered through a partnership with OptumServe, the federal government health services business of Optum, a leading health services innovation company. The 4 new state sites increase the county's testing capacity by 2,640 per week. When combined with testing presently available through the county existing COVID-19 testing network, a total of nearly 7,000 tests per week are now available for free for community members without insurance or who have been unable to receive testing through their healthcare providers. At this time, testing priority at the state sites is given to people with symptoms, as well as asymptomatic healthcare workers, first responders, and social services employees who do not have access to testing through their employer or healthcare provider. So that's the most important piece, right? So for those of you who have healthcare provider and insurance, that would be the preferred route first. For more information on testing locations, please go to occovid19.ochealthinfo.com. At the Tuesday Board Supervisor meeting, I made reference to a guidance document that HCA will be providing the Board of Supervisors for their consideration as they work on the policy considerations relating to reopening more of Orange County. As a matter of background, the state presented the 4-stage resilient roadmap on May 7 to modify the stay-at-home order and to reopen the state. On May 8, 2020, the state transitioned into Stage 2, with lower-risk businesses being reopened in a phased approach. These Orange County reopening guidelines that we will present the Board of Supervisors today will be a framework that may assist in providing an outline that our county's policymakers might take in reopening while balancing the safety concerns within our community and stressing the importance of resuming economic activities as the COVID-19 epidemic evolves. The OC reopening guidelines is intended to be a living document that remains dynamic with the evolution of the epidemic and emergence of new data. Some areas this guideline document outlines include hospital preparedness, testing and contact tracing, essential worker protections, reopening guidelines, and triggers for adjusting modifications. Again, this document is merely a tool for the Board of Supervisors to assist in helping with the policy decision that they need to make. I'd now like to invite my boss, Mr. Frank Kim, to the podium so that he may start the questions from members of the media. Mr. Kim?
Good afternoon. Moderator, do we have questions from the media?
Thank you. Yes. Go ahead, Michelle. Hi, it's Michelle Geely, KCAL9 CBS 2 News. This is for Dr. Chow, if we could please. I'm trying to understand the 229 new cases, which I believe is the highest that Orange County has recorded in a day since we began charting these numbers. And you did speak about the nursing homes and the jails, and I have a multi-part question, so I'll go through it quickly. I'm wondering how many of the 229 are in nursing homes and jails, and does this mean that we're seeing a surge here in Orange County? Should we be worried in the community, or is this confined to these settings where large amounts of people live? And we have reopened the beaches? Is it because we have people exercising on the beach that we're seeing these large numbers? Can you help us better understand it, please?
Yes, so I'll answer the easy part first. From preliminary data that we looked into, it doesn't appear that the increase in numbers are in the general public, probably in congregating setting, as we said. Now, with that said, it the number doesn't mean that we have a surge. It just means that we have the disease continue to spread, and we just need to take more cautions in how we are with each other in the public space, like washing your hand, make sure you keep a physical distance from each other, etc.
And our beaches have reopened. Are we seeing these higher numbers because perhaps people are exercising outdoors?
We don't know yet. From the, like I said earlier, this preliminary data seem to be from people in the nursing home and jail, etc.
Thank you.
And from the phone lines, if you wish to ask a question, please do press 1, then 0. Due to our time constraint and a courtesy to our reporters, please limit your questions to 1 at this time. Our first question will come from the line of Matthew Leslie, Fullerton Observer. Please go ahead.
Yes, perhaps my reasoning is wrong, but as you begin to test more asymptomatic people, would we not expect the percentage of people testing positive to go down just as a natural result of testing more people?
Yes, that is what our expectation is, that as we test the asymptomatics, that we'll obviously see a lower percentage of positives. And I think that's a point that I know most of us need to be conscious of, because less than 10%, I mean, we're in the low 6% range of people that have symptoms that are going to hospitals to be tested are turning out positive for COVID. So the vast majority of individuals that have a cough, respiratory issues, fever, they have either a flu or a cold or other type of illnesses that are non-COVID. So I think it's important for us all to remember that the COVID transmission, while it's real and we need to be very, very careful, is one of many different kinds of illnesses that are spreading throughout Orange County, and all of them are aided in terms of your ability to not contract them by washing your hands, keeping your physical distance. All of those same safety precautions really relate to those other illnesses as well.
And next in queue, we'll go to the line of Colleen Shelby, LA Times. Please go ahead.
Hi, thanks for taking my question. I had another question regarding the nursing homes and jail numbers. I'm just wondering, given these new numbers, if there's going to be more testing in those facilities, and if you have identified any other facilities that have a known outbreak or have had a spike in cases that are being investigated further.
So those are areas that I think Supervisor Steele had mentioned earlier that we were enhancing our testing for. So I'm aware that we have gone into our jail facility and we tested all of the staff there, whether they're symptomatic or not. And we are identifying enhanced testing for skilled nursing facilities. So all those areas that are higher risk, you are seeing the county and you're seeing also those facilities and the management of those facilities take additional steps to increase testing, because we know that that is where the risk is. And we are fortunate in Orange County that the infection rate within those congregate living environments has hit Orange County in a delayed manner compared to some of our large urban peers. But it is here now within Orange County, and we have to step up the amount of testing. We have to step up our protocols for cleaning, and we know that those entities and the management of those facilities are doing that, and they're doing it in collaboration with our public health staff.
And next in queue, we'll go line of Brandon Fall, Voice of OC. Please go ahead.
Hi, can you hear me?
Yes.
Awesome. So yeah, thank you for taking my questions. I have another question about the nursing homes. It's sort of multi-pronged here. Given what Mr. Chow just said earlier about nursing homes accounting for that 229 new cases that were reported out, what would the county, does the county have an estimate as to the amount of nursing home or long-term care facility patients that are currently in residence right now or presently? What would the county say to families who are out of caution thinking about pulling their loved ones out of those facilities? And does the county anticipate these nursing homes to account for an increase in cases or a decline in the coming weeks?
Hi, this is Dr. Clayton Chow again. Thank you for your question. Yes, so I want to also tell you that the healthcare agency, our public health staff, and communicable disease division have been working really closely with all the long-term care facility as well as their payer. Remember, the insurance company that place people at those skilled nursing facility also work with us as well. So there is a multi-agency collaborative approach to doing this. Mr. Kim talked about truly testing all the staff to make sure that they're not exposing the resident into it. As far as advising a family what to do when they have a person in there. So this is personal to me because I also have a family member who live in one of those facilities, and we have to make decision, right? So my advice would be you have to look at the different factor into why a person is in the resident home versus taking them back out of it, and what would the multi-social determinant of condition would affect that person. Sometimes it's safer for a loved one to stay in a care facility where they are being taken care of versus taking them home. If you don't have the ability to take care of them at home, you'll put them at a further risk for other issues related to their health. So I would advise the family that you really need to talk with the provider and weigh out the pros and cons on where that person could safely stay. So it affects me also, so I know how family go through the anxiety of making that kind of decision. Thank you.
And next in queue, we'll go to the line of Vicky Vargas, ABC, Los Angeles. Please go ahead.
Close enough, NBC. So I'm not sure who this question should be of, but getting back to the guidelines, number one, is there a disconnect between what the healthcare agency wants and what the county wants to do as far as the reopening of these businesses? And can you get into any of what the two agendas look like? Will those guidelines be presented to the board later today? Do they have to be approved with a vote? Can you give us some background on that?
Thank you for that question. And perhaps I can take the first part of it, and then I'll ask Dr. Chow to respond as well. But there is no disconnect at all. I think that when the board released their business guidance document, that was done in collaboration with county staff. We think that they provide a good framework for what is a very common sense, healthcare supported criteria for how to safely operate a business. And I think that was the purpose of the board when they released those guidance documents, was to communicate with our business community that while we support them opening as soon as possible, obviously waiting for that authority for the state of California to reduce their stay-at-home orders, but we wanted to communicate with them to let them know that all of those core principles of social distancing, appropriate cleanliness, sanitation within the business environments, all of those kinds of common sense recommendations that we've seen both from the federal level, the CDC, the state level, the California Department of Public Health, and at the local level from your health officer, that those are all rooted in the same general principles, and they made their way into that business guidance document. What you'll see from the county healthcare office in terms of recommendations for additional policies and guidance that we are recommending for the board to consider is more detail, and also looking at the metrics. So as an example, the governor had identified that if counties wanted to advance more quickly through phase 2, that you could not have more than one death in 14 days. We think that that's a very restrictive, difficult measure for us to overcome. What we believe is more appropriate would be that we see stable or declining number of deaths over a 14-day period. That is just one example of the type of detail that we as staff would like to present to our board to consider as a further specificity and support within the context of how does Orange County, from a public health perspective, open in a manner that is safe and reasonable. So that is the kind of information that you will see in our documents. I don't know if Dr. Chow has any additional comments. He's saying no. But that is what we're looking at, is providing that type of additional guidance. Did I address your question? I think I did.
Next in queue will go line of Spencer Custodio, Voice of OC. Please go ahead.
Hi, this question could also be for Chairwoman Steele if she's around, but also certainly for CEO Frank Kim. By the way, thank you for taking our questions again. My question is, with the incoming federal money, has there been any discussion or policy discussion ideas on maybe some type of rental assistance, mortgage assistance for people who've been, put out of work by the virus or have had their income severely, cut down from the virus? And if so, how much would that fund be?
Certainly. I think what you're referring to is with the CARES Act funding that was allocated to the county, is the county considering adding additional funds that would provide assistance to businesses and individuals? I think that's your question, and if that is, those discussions will occur, I believe, on Tuesday. As you know, the board, Chairwoman Steele and Supervisor Wagner had provided a recommendation to the board this past Tuesday to consider $75 million in funding to support local businesses. And the board had that discussion and agreed essentially to have further discussion about that topic in this upcoming Tuesday. So my understanding is that and other uses of CARES Act funding will be discussed on this upcoming Tuesday, and we look forward to that. But in terms of individual funding, that was not part of the original presentation from Supervisor Steele and Supervisor Wagner. That was to support local business grants. We do know that the federal government has made a number of funding available, not only in terms of sick time that they required employers to provide, but also in expansion of unemployment benefits. And the federal government has also provided 2 rounds of the Paycheck Protection Program to aid small businesses. So across a variety of different funding sources and programs from the federal government, we have seen the benefit of that within our county to both individuals and businesses.
And next in queue, we'll go to the line of Margaret Carrero, CanX. Please go ahead.
Yes, thank you again for taking our questions. This may be for Dr. Chow, and I'm not sure if you'd answer this or not, but with the rise in cases, I know you mentioned nursing homes, and you mentioned jails, any indication that you could trace any of those new cases back to the beach protests before the beaches were reopened?
I believe Dr. Chow answered that question earlier, and from our initial review of the data, it does not suggest that there's a link between the beaches opening and the rise in terms of the positive virus infection rate.
And next in queue, we'll go to the line of Jessica DeNova, ABC7. Please go ahead.
Hi, yeah, sticking with that 229 total that we saw today. So when I look at your guys' website, the cumulative cases to date, it does say there that 407 are from SNF, skilled nursing facility residents, and 331 OC-JO inmates. So you are breaking down how many are skilled nursing facility residents and how many are inmates. Can you please tell us exactly how many of the 229 are from skilled nursing facilities and from OC-JO inmates? And also, we know we're breaking it down by city. What is the city that has the largest number of positive cases for Orange County for today?
Thank you for your questions. As far as the cases per city, I believe we have that online. Yes. As far as the number of additional death, and where they're from. I don't believe we have that information, but we can. I can look into it and have our PIO get back to you. Thank you for that question.
Just to clarify, that was not the question. I'm just wondering, for the 229 positive cases for today, how many of those 229 positive cases are from skilled nursing facilities and from jail inmates?
Yes, yes, ma'am. I understand your question. So we'll look into it and then we'll get back to you. I apologize. I don't have that with me.
And thank you. Our next question will come from the line of Paul Anderson, City News Service. Please go ahead.
Hi, I just wanted to ask, the letter that was sent out by the mayors in the county, it sounded like it was a recommendation or to support the HEROES Act. I just want to check to see if that is the case. And I wondered if you had any kind of an update on Project Room Key 2 and the numbers there, and any breakouts with in the homeless facilities.
Sure. Thank you for that question. So the action alert that was sent out that was supported by Orange County Cities as well as all 5 board offices, that was related to our support for the CARES Act. I guess I'll call it the CARES Act 2.0 that's being considered in Congress this week. We believe, at least my understanding is, the House is voting on that package tomorrow. And we thought it was very important for Orange County Cities and the counties to express their position in enthusiastic support for that funding. We know that counties and cities have all had devastating loss of revenue, and maintaining our essential infrastructure will be challenged in this upcoming year. So access to funding to support that basic core infrastructure, where it could be the social safety net, it could be law enforcement services, it certainly is public health services. All of these things are important to the vibrancy of maintaining stability within our Orange County community. And we do need additional funding to support and maintain that. I think your second question, Paul, could you repeat that for me? Oh, on Project Room Key. I don't have the data with me, but I will provide that to our PIO and she can get that to you. I believe what you're looking for is a breakdown by facility and the number of occupants. Is that correct?
Yeah, and also real quick, as far as the governor's May revise, do you have a ballpark on how much that would affect your budget this year, like how much you might have to make cuts?
Yeah, we don't have that yet. We know that the governor released his budget today around noon, and my staff right now are participating in state association calls, trying to get additional information. Our normal practice in that is it takes us about a week to figure out what the local community impact is, because when the governor initially releases his May revise, generally it provides a high-level summary of what they expect their overall revenue picture to look like, and their funding level at a very high level to the various state programs that counties received direct allocation on. And many times there are supplementary schedules and things that take days to be released. So I haven't had a chance to look at the May revised in any detail. It depends on how much of that detail is incorporated in his initial release and how much of that information will flow in the coming days. From a county perspective, I have sent out directive to all of my departments to analyze the May revise and return their individual department impacts back to the county on May 22nd. So it won't be until next week that I have a good top-down view of how it affects each of my county departments.
And next in queue, we'll go line of Nick Gerda, Voice of OC. Please go ahead.
Hi, everyone. Thanks for taking our questions. I had a follow-up question for you, Frank, on following on the last topic. You had mentioned how the county is looking at a really devastating loss of revenue that could impact services for the most vulnerable in Orange County. I had a couple follow-up questions on that. If you could speak a little bit to the general scale of what the county is looking at in terms of lost revenue, if it's in the hundreds of millions or potentially billions of dollars. And can you translate that into what these potential cuts would mean for the people of Orange County, the real world impact of that?
Sure. Thank you for that question. So number one, we know that there are several broad categories of funding that are affected by essentially business activity. Number one, Orange County, we have a public safety sales tax. 80% of that public safety sales tax funds core operations of the sheriff coroner operation program. 20% of that goes to the district attorney. Between March 1 and through next fiscal year, which is about a year and 3 months or so, we expect revenue losses in that category of approximately $140 million. So that is a devastating loss in terms of funding to our sheriff and district attorney. In terms of realignment revenue is generally funded by sales tax and vehicle license fees. And when we close down businesses and slow the economic engine of California, sales tax and vehicle license fees drop dramatically. So we're expecting to see significant reductions in both of those funding sources. Realignment funds a variety of county programs, from public safety, from AB 109, our court security programs. It funds the basic social safety net. And what that means is we have programs such as CalFresh, and we have Medi-Cal, and we have programs that support those that are in most desperate need because of loss of employment, such as general relief. Those programs have an administrative component. So when we lose realignment revenue, we lose our ability to fund administration. And what does administration mean? That means that if you've lost a job and you're out health insurance and you want to apply through the county to become eligible for Medi-Cal, which would give you access to CalOptima, which is our managed care system, and you want to apply, you have to meet with an eligibility technician. That is administration. That is what this money funds, is the person who sits across from you that looks at your application, verifies your income, verifies your identity, helps you complete that form, and then they process that for support. The same thing for general relief. When you have lost employment and you are food insecure, you're looking for assistance from the federal government to provide that food assistance, whether it's an EBT card or other support. And in order to qualify for that, you must meet with one of our eligibility technicians to process that. So when we talk about what does it mean in terms of real-world impact, the financial picture at the local and the state level is that, number one, we'll have less money to fund sheriff and the district attorney. That affects our public safety. We do not want to see that service decline, but we may have to make some cuts there. Number two, we do not want to see a reduction in our ability to meet the rising demand for food assistance and for medical insurance purposes. When you lose your job, generally you get disconnected from income, which makes you food insecure, and you get disconnected from medical benefits. Those are two services. We know that Deborah Bates, our social services agency, had reported to our board I think it was about 2 weeks ago, that there was a 100% rise in the demand for food assistance programming. And there was over a 20% rise in the demand for access to Medi-Cal. So at a time when we're seeing a rise in the demand for these core safety net services, the funding that is going to support the actual enrollment into these services is declining. So that is the challenge. And that's what it means in terms of real world, Nick, is that we're going to be asked to do more with fewer employees, and we're going to struggle to meet the basic funding needs for our district attorney and the sheriff. Next question, please.
And once again, as a reminder, any additional questions, please do press 1, then 0 at this time. We go directly to line number Chip Yos, and Chip Yos is with KTLA. Please go ahead.
Oh, hi there. Thanks for taking my call, and I'll preface this. I had to step away from the phone for a few minutes, so if one of these questions has been asked and answered, I'll go back and look at the tape. But I had two questions on testing. One being, do you guys have a response to the letter that was sent by the Congress members to the county the other day regarding testing and their concerns over the number of tests that have been done Secondly, as you probably heard, the city of Irvine has approved to start some antibody testing and antigen testing for residents here and also people who live outside of the city. My question with that is, do you think that's a good idea? Do you think there's a benefit to offering either antibody or antigen tests to the public?
So I'll answer the first question, and then I'll ask Dr. Chow to address the testing within the city of Irvine. Regarding your first question, I'm sorry, could you repeat that quickly? I just lost it.
Oh yeah. The first one was the question regarding the letter that was sent
letter
by the congressional delegation about
Thank you. So we did receive a letter signed by a congressional delegation. They expressed some concern over the testing capacity within Orange County. We absolutely will address that. We had a conference call with our delegation members earlier this week. We spoke of it. We agreed to provide them additional meeting. I offered to meet with them in person if they would like to come in to have a more robust discussion over every one of their questions. I think it's very important to maintain a strong communication line between the county and our delegation members. We absolutely welcome their questions, and that is the reason why twice a week we host conference calls with the delegation members, and they last approximately 1 hour, and we're open to receiving their questions and responding as directly as we can. I do know that in Orange County, as was discussed earlier today, there's a difference between testing capacity and those that qualify for testing. So all throughout the state of California, there is a real struggle, I would say, and I speak from a county administrator side, not from a public health perspective, in terms of creating this broad testing network. And part of the challenge is that, number one, most of the testing across California is occurring in a hospital setting. Most Californians have health insurance, and the best place to get tested is through your health provider, because you are connected immediately to your local physician. And if you test positive, you'll be able to work with your local doctor in terms of how you manage the condition and the treatment of that condition. And then in terms of the kind of the rise in the additional testing clinics, why is the County of Orange opening community clinics? The reason why we're doing that is in areas across the county, we have pockets of our population that are either underinsured or they are uninsured. And what we want to do is make sure that that lack of insurance is not a barrier to any member in our community that has a symptom, is not feeling well, and that becomes a barrier to them getting appropriate treatment and testing as it relates to COVID. That is the reason why today there are 14 clinics that are available for residents within our community that they can call, make an appointment, have a conversation with a clinician or a doctor, come in and complete their testing. So that is available to them. Every week our goal is to continue to add additional clinics. We want to get to a point where we have really saturated the market and that anyone that has any symptoms at all can quickly and easily access no-cost testing related to COVID-19. That is the reason why we're doing that. I'll ask Dr. Chow to address the question about the city of Irvine and their action to open up a testing location.
Thank you, Mr. Kim. I actually wanted to say the Voice of OC published an article today that addressed that and is actually very accurate, and I would recommend that you read it. Nick, how's that good for advertising for you, Nick? I've said that at the board meeting this Tuesday, and I'm going to say it again. There is value for serology testing, or known as antigen or antibody testing, but it's only for academic purposes, right? So you want to do research, number one. Number two, perhaps you even want to know the antigen level in people who have been infected, so you can perhaps get their plasma and use the plasma as a treatment option for people who are very, very sick. And then the third way is to use the antigen test to figure it out from a surveillance perspective in a group of high-risk people, how many people are actually infected. That's it. The CDC said that there is really not recommending, or actually says no use, and I forgot the exact word, but you can look it up on the CDC website. There's no usefulness to the individual testing, the serology testing, because it doesn't tell you that you develop immunity, but in fact there are people who've been infected, recover, and get infected again. It doesn't tell you whether or not you have antigen that it's going to be protected, you are protected. So it gives people a false sense of confidence, and then they go out and they might spread the virus again. And so the science today telling us that we don't understand much of it yet, and so there's not a recommendation for really individual use in doing the antigen test. So I hope I explained that well, but again, I'm going to refer you to the Voice of OC article, because it's not just my opinion. There's other medical folks' opinion as well. So thank you for your question.
And Speaker, currently we have no additional questions in queue. Please do continue.
So thank you. If there's no additional questions, I think we can conclude the media briefing. I would like to thank everyone for attending and appreciate the questions from the media.